Sacramento County Public Health has joined with other city, county, and community leaders to dramatically increase pedestrian and bicycling projects in the Sacramento region by seeking millions in federal funding to promote those projects.
We are here today because we are seeking as a region $50 million to improve bicycles and pedestrian access here in the city of Sacramento and throughout the entire region.
Being physically active is more than just a personal choice. I think that we all intuitively know that when there are attractive, easy places to walk and bike, people are more likely to do so. And now there is mounting evidence that that in fact is the case.
It is about health, it is about transportation. It's also about creating great places, about experiencing what we're accomplishing here on the waterfront and in our two downtowns on a human scale. And the kind of scale that you don't appreciate as you drive by at 35 or 45 or 75 miles an hour on a surface street.
There are studies that show that over 43% of adults that live near a park actually walk more than those adults that don't live near a park. 63% of seniors that are able to walk to the grocery store do so when there is a grocery store close enough for them to walk to.
We need to have sidewalks throughout our city. We need to have safe streets. We need to have crosswalks and stop signs and traffic signals. And to safely bicycle, we need to have complete bike lanes. We need to have bike lanes and we need to have bike ways and bike paths.
We have a pedestrian master plan from both the city and the county and numerous examples of ways that we're working to complete the streets. But we do need more because we need a complete streets network throughout the region.
Half of all trips are under 3 miles in distance. About a quarter of trips are under a mile. Yet most of those trips are made by automobile. Those are trips easily made by walking and biking. We
all know that the lack of physical activity causes numerous physical and mental health problems, especially when over 50% of adults in our community are either overweight or obese, and 30% of our children are overweight or obese. And we are seeing an epidemic, essentially, of diabetes.
So this is an effort which we are hoping to be funded in 2010. We're starting it today, and we have a lot of work to do to make sure that we are able to get that funding here in our region. Complete streets!